Welcome to Break Everything. Your host, Lisa L. Levy, will guide you through critical thought conversations and a journey of directed disruption that makes a difference. Experience bold conversations with industry leaders who are willing to challenge the status quo.
Hello and welcome to another episode of the Break Everything, where I interview industry leaders who want to think a little bit differently. You can find the show on YouTube, LinkedIn, Apple Podcasts, Google Podcasts, Stitcher, Spotify, iHeartRadio, and more.
Wow.
I know.
It's like the place.
That's a lot to get out. Today, my guest is Kenneth Wright, and we'll be discussing health insurance in the field and interesting and different ways of tackling that subject. Kenneth is a serial entrepreneur and intrepid traveler. He has a holistic approach to problem solving that is informed by his cross-traditional education in the sciences, business, and humanities. His goal-driven, outside-of-the-box thinking has spurred various businesses to success. While on Madison Avenue, his branding and positioning was key in launching Miller Genuine Draft and AccuView Disposable Contacts, just to name a couple. And he turned his marketing skills to the field of health and wellness, building multi-million-dollar practices for medical and wellness professionals. As a workplace wellness pioneer, he helped corporations cut their healthcare costs and build employee productivity by the development and implementation, easy for me to say, of wellness strategies and practices. Currently, he's using the brand the Health Insurance Savant. Kenneth now brings his expertise to solving the health coverage needs of individuals and small businesses, very, very important spaces in need of help. His experience with healthcare providers, health insurance companies, and its end users honed his skills in identifying the best value health plans and helps his clients after their purchase to navigate the often confusing and frustrating healthcare system. Kenneth also describes one of his favorite pastimes as stirring the pot, which for this audience makes it very clear why he's here with us today. Kenneth, welcome.
Thank you very much, Lisa. I'm glad to be here and glad to add my voice to what I think is a very, very important topic, which is how can we get healthcare to work better?
And right, it's a big topic and it's nothing but opportunity. So let's let you dig in a little bit and share with us a little bit about who you are and how you made your way into the healthcare field.
Well, I didn't come to healthcare through the healthcare window. I came to healthcare really through the marketing and advertising window. I was living in New York and I had left Madison Avenue. And I just by happenstance found some doctors that wanted to build their practices. And what we decided to do was we decided to go into corporations and do screenings and seminars where they would then meet potential patients and then sign them up. And that's really how it started. I had to learn about insurance because the doctors only wanted to take certain plans. So I learned about insurance from the provider side, which were the best plans, which paid the best, which had the best networks. So that's how it all started. And then after that business took off, I was purchased by an insurance broker. And his goal was to provide wellness to some of his insurance clients. And that's where we started having some cross purposes, because the goal of an insurance company really is to have nobody take advantage of the insurance. The goal of an insurance company is to have no claims if possible. So working for an insurance broker that was selling to corporations, doing the programming I was doing was at counter purposes. Yes, prevention makes sense, but if people do something with that prevention, it costs the company money. So that's where we started having a disconnect. And after I fulfilled my employment contract, I ended up in Miami. And that's another whole story. I joined Teach for America. If people want to hear that story, that's a whole different story. But that really isn't about healthcare. But I ended up being in Miami. And then I decided to go back into health insurance because it was a field I'd found really interesting. And rather than going to the corporate side, which can be very, very political. I decided to deal with small businesses and individuals because they are really in need of information. They are the ones that really are not, it's really hard for them to figure out what to do and how to do it the best way.
Well, health insurance is a difficult topic, right? Over the last 30 to 40 years, the role of health insurance has changed significantly. There was a point in time in the past when primary health insurance, right, those catastrophe type plans were the common norm. And then over time, as corporations started offering benefits to entice employees, the types of coverage, the idea of copay and services, right, has evolved and changed. And what we sort of expect from our health insurance today is probably very different than what it was envisioned as being originally. And claims happen all the time. So there's that whole disconnect. How is that playing out in the space with these small businesses and the individual coverages?
Well, I mean, I think, and this is where the disconnect is that health insurance is insurance, right? There's a difference between health insurance and health coverage. Yes. And people want health coverage. They don't really think that they purchased health insurance. And what I mean by that is, I'll use the best example, which is a car. You buy car insurance. You don't want to use your car insurance. Your car insurance does not pay for your tune-up. It doesn't pay for your tire rotation. It doesn't pay for all the basic everyday things that you need to keep your car working right. Those you pay out of pocket. And that's really the true model of health insurance. When HMOs got involved and they tried to, in health maintenance organizations, and that's where the whole concept of copays came up. Whereas you would pay a small amount to see a doctor, right? And then that doctor would receive a certain amount of money from the insurance company, but they're often disincentivized from seeing people because that saved the insurance company money. People have to understand when they enter the insurance marketplace that what they should be concerned about is not that $50 cost, it's that $50,000 cost. That's how insurance is built. But there's a lot of confusion in the marketplace about what it should and what it shouldn't do. And then also, one of the biggest problems is just people's own income sensitivity to what they can or can't afford, or even more so, what they want to afford. People would rather pay another $1,000 for a larger television than think about paying $1,000 for some type of medical claim.
Well, right, because the television is fun and the medical claim is not fun.
Yeah, they also think that should have been paid for. They think that's what they're paying for.
And that's interesting. And I appreciate the simplicity of the car insurance analogy, because it is something that we're all familiar with, and expectations of consumers for those two products of insurance are totally different and totally out of whack. Exactly. How did we get so out of whack?
Well, we got out of whack. There was a time, and when I started my business back in the 90s, there was a time when the average plan was an indemnity plan where there was a deductible. The deductible ranged from $500 to a couple $1,000s. And then people paid 80-20. The insurance company paid 80%, and then the individual paid 20%. And that was standard, okay, with a certain cap on it, but that was standard. Right. What happened was that people started, if somebody did that, oftentimes providers would write off the 20% that the individual was going to pay. Mm-hmm. There were big claims coming out of that. So what they decided to do was, rather than pay the provider that 80%, right, or a portion of that, they would instead say, rather than you getting $2,000, I'm going to use an example, $2,000 for a foot surgery, you're going to get $500 for that. So, and when that happened, what they put into place was the whole copay structure to allow, and then that was a way for people to take pause. Am I going to spend that money to go in and see that doctor, right? And the problem was with the copays were set so low that people just started doing that. And that became the norm for certain networks. And it was all on the insurance companies and all on the providers. And the consumer really didn't care very much because they only had to pay $50 or $100 or $75. Didn't really matter.
Yeah, except for now, as we extrapolate that out, we may pay that $50, but for the provider to get a fair claim and a fair wage to themselves, right? What they bill is no longer the $2,000, it's $10,000. And everything is, and I'm sorry, I'm coming back to it, that out of whack sense. What is an actual surgery? What is the actual cost of a surgery? What should it be? And can we ever get control of this again?
Right. Yeah. And there is no actual cost of anything, right? I mean, that's the bottom line. We live in the United States, and I work with plans that the plans that I specialize in are underwritten plans. So I don't sell Obamacare, which is incredible coverage. If you are sick, if you have a chronic condition, Obamacare is incredible because it will take care of you. The problem is that it can also be costly because it takes care of everybody, no matter what their condition is.
Right.
I sell underwritten health coverage, which means if you meet a certain health requirement, you can qualify for it and pay a lot less. Now, one of the features of these plans is that they pay certain amounts for certain things. And I'm going to use a good example, which is I just had a phone call from someone last week about wanting to get a mammogram. And thank God she called me because our plan pays $250 for a mammogram. I live in Miami, and the average cost of a mammogram in Miami is about $175. But you can pay $100 or you can pay $1,000 depending upon where you go. So the reason I'm bringing that up is that it really is up to the provider how much that they want to charge. And certain plans will reimburse different amounts based on the negotiated rate with that provider. And oftentimes the consumer themselves, unless they dig into it, which most of them don't, they're not going to know necessarily what their cost is going to be.
It is absolutely crazy. And I actually lived that exact story last year and had gone in for my mammogram, and they tried to bill insurance that I no longer had, and then sent me a bill for that contracted rate. They were supposed to bill my primary care physician who had a direct billing relationship, and the difference was $150 versus about $1,500.
Okay, exactly.
Right, for the exact same thing, right? The service
Exactly
had already
right.
been performed. Absolutely mind-blowing, the difference. So I want to just explore a little bit. You started talking about the products that you sell. So the underwritten type insurance, which is different, is that more that indemnity type style of insurance that we were more familiar with in the 90s?
Exactly right. It is exactly that. We have plans with no deductibles, no copays. Some of the plans have a standard deductible of $2,500 or $5,000, even $500 for an accident. So, these are much more in line with what we knew before. But it's interesting because most people that see them never saw them before.
They don't know or they don't remember.
Yeah. So it's a big surprise. But they really, and again, these plans provide care they provide large networks. These networks
Mhm.
could be a Cigna network or a United Healthcare network. Oftentimes they're national networks. So you
Right.
can see pretty much any doctor you want to. Mayo Clinic, Cleveland Clinic, MD Anderson in Houston. So again, those are the plans, but the difference is you have to qualify.
Yeah.
And that makes it, and the other thing too is the real benefit of the marketplace plans is can be cost. Uh, when the American Cares Act was passed a year and a half ago now, it increased the subsidies in the marketplace.
Mhm.
So I had a couple the other day that live in Tennessee, I think. They're going to make $110,000 this year, and they could have paid $24 a month for health coverage because they would have received a subsidy of over $1,000.
Wow.
So for a lot of people, those are great options. And those are people with no medical problems, but because of their income, because of where they live, because of how the
Mhm.
marketplace works, they were able to receive and get an incredible subsidy. So when I say that the plans I specialize in, I sell are underwritten plans, that doesn't mean if I speak to someone and the better plan for them is a heavily subsidized plan, that I'm going to say, don't buy it, buy this instead. The important thing is that people get the best coverage at the best price.
Absolutely. And understanding the best coverage is an individual need. And also one of those things when we start talking and thinking about corporate health plans, I mean, often there are multiple choices that you can pick from, but
Yes,
it's still a handful of one size fits most, as
yes.
opposed to truly curating the insurance coverage that you need for you and your family.
Yeah, but the average person has no idea
Yeah.
what and again, if you look at the marketplace, you will see, like I live in Florida, we probably have 8 or 10 plans available, 8 or 10 carriers available, and each of them have 15 or 20 plans.
Yeah.
I mean, for someone to try and sift through that and make sense of that is next to impossible. Um, and then trying to enroll through healthcare.gov can be a nightmare for people. And if you make a mistake, you're not coming back from it, meaning that it's something you'll get stuck in the system somewhere. Uh, so that's why today I think agents are much more important, but are not just important for the choice. Where
Right.
I do most of my work is afterwards. So I work with my clients after they've bought a policy. And that's really when you talked in my intro about helping them navigate the oft confusing and
Mhm.
frustrating healthcare system. Um, that's my gig. And I've gone through it myself. I'm frustrated and confused by it myself. I'm out there fighting those same battles
Yeah.
so it's something that to try and sift through all your claims and all your explanations of benefits, and did they really pay what they were supposed to pay, and did they really get billed what I was supposed to get billed, and all that stuff. It's a full-time job almost. So
It is, and you have an exceptional background. You know, as we talked about in the introduction, your varied background in in your formal education. Does that give you superpowers in this space when we're dealing with people and their emotions? We're dealing with bureaucracies in the form of the carriers, and does that bring you? How does that inform
yeah,
where you are today?
the grounding I have is in medicine. So I have an undergraduate in medical technology. So I understand the underwriting process and disease states probably better than 90% of all the agents out there. I know it. I know what, when somebody tells me that they have, a hypothyroidism or a goiter, or they have this, or they have that, or, Cushing's disease or whatever it is. I know what these things are, and I know what it could cost or what type of plan is going to best serve their need right off the bat. So that's one thing. And then having a master's in business helps me understand a lot of the things today that I have to deal with, like are the subsidy levels, 8.5% of your income, all this kind of stuff that comes down the pike. It's helpful to have an understanding of the business side, and also having been with the healthcare brokerage was another inside look at that. And then I guess that my master's in religion, hopefully, I chose that because of who I am rather than how much that influences me, right? So I'm hoping that's kind of like the compassion and the desire for helping make the world a better place. However you want to look at your faith journey,
Right.
those are things that that are of me, versus things that I learned to bring to my work. So.
Well, and I also have to imagine, right, that hook ties into having empathy and understanding that, people going through the journey, and health insurance is an emotional process for most of us, because when something goes wrong with our health, we're in a state of fear.
Yeah.
And to support your clients and through those times when I filed a claim and it doesn't work right, or I don't know what I need to do to get the care that I need, you sort of are in the mix of those conversations, helping them navigate.
A lot of times. And but even the more frustrating thing for most people isn't that, though. It's what's it going to cost me. That's when the emotions come out. That's really
right. Those are the biggest emotions, right?
Yeah, those are the biggest emotions. It's once they've come out of the woods of whatever the healthcare issue is, the bottom line is am I being taken advantage of?
Yeah.
And because people don't understand things, that's an easy place to go to. I mean, I do that with my cable coverage. I do that with a lot of things I don't understand. I'm like, is this really the best plan? Is this really, what are you paying for here? This many channels versus this premium channel versus,
And those are things that we use day in and day out, and we rely on. The complexity and the confusion from a healthcare perspective are all of those terms, that language, the things that were done for us. We don't understand the language.
No, at all.
As civilians, we don't get it. And it's partly,
this is, so I'm going to throw out a term that I don't hear at all anymore. And I used to hear this term probably 10, 15 years ago, which was consumerism, right? The idea of healthcare now is a consumerist model. That's why they want you to go online and enroll. And if you go online and enroll, there'll be a million things that you can take advantage of to learn about your health plan, to learn about the best way to seek health care, to learn who the best doctors are, to learn all this stuff. But the fact is, nobody's taking the time to do that. And the health insurance business is saying, well, look, we provide you all the information. You shouldn't be confused. It's all there. It's the same thing as I get out and I drive a car. I don't go through the manual. I have a manual in my box. Something happens to the car, I try and figure it out. But I don't like take that manual and go, oh, let me see what's going on in my car. Yeah. And then I take it to the mechanic. The light goes on, take it to the mechanic. I mean, it is a really, really hard road to hoe, to expect people to become experts, not just in their own health care, but how to manage the system that provides that care and the payments involved in it. It's daunting.
It really is. And with that idea of things that are daunting, you have built with your brand, the Savant brand.
Yes.
And the Insurance Savant is one arm of it, but there are others. What are you trying to communicate with that brand?
This will take us back to my advertising career.
Okay.
And also ironically, with my religion work, which was I did a lot of work in the humanities and a lot of work in psychology. And Carl Jung is one of my heroes. And Carl Jung had a theory of what he called archetypes. And archetypes are deeply embedded images that are shared between all cultures. Like all cultures have a sense of the sage, there is a wise man. They have a sense of the helper or the nurse, someone who's a caretaker. They have a sense of the warrior, the person that's going to step out and protect the tribe. So when I started thinking about my brand, I came to the Savant because it communicated, for me, I believe it communicated two very important things. One, it communicated the sage primarily, which is what, if I'm going to find out about health insurance, I want to go to someone that knows about it. Not just someone that's selling it, but someone that's wise in that. And then my secondary within that is the helper or caretaker model. But what really I wanted to primarily communicate was the sage model, that you can depend on me to know this field, know how to do with this, know how to take care of everything. And now I've taken that same concept and that brand, and I moved it into a business development group I'm building out, which is kind of a networking, kind of a mastermind. But the concept within that is the same thing, is that we're all savants in our own field. But where does that take us? And can we share that business acumen to help each other grow and build our businesses? So our meetings are workshops on where we do that. And one small thing is, we know each other from a networking group, kind of, right? So, and networking groups are all about connecting, and that's what we're doing here. And you invited me, and right. But oftentimes that's where networking ends. And you have, by bringing me here, you've brought something to me, right? So the whole difference is within my group, we are working on things within our meetings. So when people do their traditional commercial, they talk about, these are the benefits of what I can provide you, right? I'm the Health Insurance Savant. I sell the best health insurance at the best price. I sell to individuals and businesses, blah, 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 right? And people are like, after a while, they're like, whoa.
Well, because we don't actually care, because that's not talking to the value it provides me actually.
Exactly. So what people want to hear, they want to hear about stories of success. Yeah. So that's what we worked on this week, was making sure you had a story of success. Like I was just telling earlier today about that person, I was able to save all that money. I even had another guy that moved from one zip code to another zip code. And just in that zip code move, this is the same guy, he was able to save $1,000 because his income changed. And because he changed zip codes, he could then qualify for the marketplace. Now,
those are little details.
Yeah. And that's the kind of story people want to hear. And they're like, so that's what we do in the Savants of Business. And then the last piece is there are prepaid legal plans out there, and this is the Legal Savant. One of the big concerns, against the same thing as healthcare, what's it going to cost me if I need to use an attorney? People are afraid to call attorneys, especially business people. And I can give you my example. When I was in business in New York, my first attorney experience was, he asked me for a $15,000 retainer. A week later, he said, it's used up. You need to put more money in there. I was like, how could it be used up? So these prepaid legal plans allow you to spend $100 and change a month and receive great legal care and legal advice. And there's a lot more bells and whistles to it. But the concept is, again, being able to provide something for somebody at a set cost that they'll understand. And yeah, that's the best way to say it. So.
Well, and it also, it gives the consumer some power and understanding of what I'm actually getting, because those retainer fees are very scary. And yet they do break down to hourly billables, but you don't necessarily know how. And with the prepaid plans, I'm guessing there are some nice terms and conditions that should be pretty understandable.
Yeah, and that's exactly it. It lays it out very, very, very specifically. I don't want to go into details, but yeah, you really do know what you're getting for that and not getting.
Right.
Which is
what's in scope, what's out of scope. Two of my favorite things.
Which is even, I think, as if not more important, because that's where people, again, that's the problem with health insurance.
Yeah.
People are happy with what they're getting. They're just not happy with what they're not getting. Right. Yeah. So.
Absolutely. And that is right. When we're getting what we expect, we're happy. Once we have an expectation that's missed, that's when we go off the rails and, lose our cool.
Yeah.
Kenneth, we've had such a great fun with this conversation. We've been all over the place. I'd like to wrap us up with my favorite question. If I were to give you a magic wand, how would you use it to improve the healthcare industry?
It has to be cost transparency. There is just no doubt in my mind. Now, honestly, what would be great would be if we could make costs the same across all providers, but that won't happen. And I don't even know if that's fair, because different providers have different educational levels. They live in different places where there are different costs involved. So there's a lot of moving pieces there. So let's throw that one out as just basically unreasonable. But okay. What I think is very reasonable is for you to know what to expect to pay when you go to a hospital or go to see a doctor or go to see anybody for what you're getting. And there is a lot of work being done in that area right now. I'm very, very optimistic that we're going to at least move a little bit closer to that area. There are some hospitals that I can't remember the name of the site now, and I apologize for that, but there is a site out there right now that's compiling a lot of this data. The problem is that in order for it to work, everyone has to play. And there are a lot of people with disincentives to want to play. They don't want you to know what it's going to cost.
Oh,
yeah,
absolutely.
So that's really one of the problems. Now, we had a great thing happen this year, which was there was an act passed by Congress, the No More Surprises Act, which I think is, again, it's legislation that is benchmark and revolutionary. And it's really simple, which is what was happening to people where they were going to an emergency room, being treated out of network for an emergency, and then being billed for that, right? Being billed for that. The idea was that they had no other choice.
Right.
So from now on, if you have an emergent, and it has to be emergent, right? It can't be, I had a headache. It can't be like I twisted my knee. But if it's a true emergency determined by the powers that be, that has to be billed as an in-network cost.
Right. And
the second one, and I've had this happen, my wife has had this happen. I mean, so many people I know have had this happen, which is you check out a healthcare provider to get a procedure done. They're in network. The hospital's in network. The doctor's in network. The rehab's in network. And you go in, and then afterwards you get a bill from the anesthesiologist that's not in network. And this, and it's just not only anesthesiologists. I'm just going to point out the one that experienced I had. It's a lot of people that's happened to. That can no longer happen. So if you have been led to believe that you are going to receive all in-network treatments, then they have to bill you in-network. And if it's going to be out of network, they have to let you know that so you can make another choice. So that's called the No More Surprises bill. That's the vernacular for it. I think it's incredible. And that's, again, taking us in the direction of the cost transparency thing. We have a long way to go to get there. But when I go to buy a car, I have to negotiate, but I know what I'm paying for it. Healthcare is the only thing that you have no idea what it's going to cost you.
Right. And while you were talking, an analogy that popped into my head, right, is as you were talking about the disincentives, what popped into my head is, the NASA cost of a hammer, that $400 or $500 hammer, right? The hammer manufacturer is going, yes, I'm making a huge profit, but that hammer still only costs $2 to produce. Where does all the rest of the money go? And in healthcare, it's the $10 aspirin, I guess, might be the answer to that, analogy. And we should know what the costs are. That is probably my most passionate and favorite response to the magic wand question. And because, as I've shared, right, I've had those challenges with billing, and it shouldn't be surprising. Kenneth, I really appreciate the conversation we've had today.
Well, thank you so much. This is something people say, why are you selling health insurance? I find the field fascinating. I really do. I find every part about it, even the confusing parts, all that stuff. It really is a puzzle and a mystery, and people need help. And that's the bottom line. People need help figuring it out. And I like playing that role. It's not something that's simple. And again, there are a lot of people out there that just push policies, and that's like in any business, right? You're going to find people that are just out there pushing stuff. But there are people out there like myself, and I'm not the only one, that really are interested in providing the right care at the right cost and making sure that their people are taken care of. And this is not something to be messed with. I mean, 95%, maybe it's a little bit lower than that, but a large number of bankruptcies in the United States are a result of medical billing, people not being able to pay their medical bills. And that is tragic. I mean, that people are going bankrupt to pay for treatment just should not be. I
survived cancer and now I'm bankrupt.
Yeah, exactly.
And it's a horrible story, and it happens every day.
Yeah, that's exactly right. And it doesn't, that does not need to happen.
No. All right. Well, this is going to wrap up our conversation today. Kenneth, again, thank you so much for being here. And for those of you who are watching or listening, please continue to do so. And don't forget to subscribe to the channel on YouTube.
And can I just say one last thing? I just want to say that what Lisa is doing right now is critically important. The idea of really trying to help break through some of these. Our healthcare system in the United States we have a great product. We provide great care in the United States. We just got to figure out how to make it work better for the consumers. And I don't know what the answer is, but that's what we're all here to try and, put our 2 cents in and help try and figure that out. And it's a dialogue that we have to have. So thank you, Lisa, for engaging in the dialogue.
You are so incredibly welcome, Kenneth. And stay tuned for those of you who haven't heard me talk about it. There is a phase 2 of this kind of experience, and maybe we'll bring Kenneth back to a panel and we'll dig a little bit deeper into cost transparency. But for today, that's it. We're out of here.
You have just experienced Break Everything with Lisa L. Levy. Critical conversations on directed disruption that makes a difference.